I'm a former news anchor and network medical reporter who found herself on the other side of healthcare after a diagnosis of leukemia myself. Then I had a bone marrow transplant, and 5 years later I was diagnosed with breast cancer. So when we talk emotional impact, this is so deeply personal to me, as it is for different reasons for every single one of us. It's just a privilege to be up here, and I'm so thrilled that AbbVie is leading the charge, and actually we're talking about the psychological, the mental well-being of patients. The other reason it's so personal, not only being Latina, but from my own experience during my leukemia treatment, I was separated from my then 2-year-old son for an entire year. And as a result, because of the lack of help and resources I had, I now suffer with cancer-related severe PTSD and depression. And so this is how I'm able to advocate and just channel everything that I've done and do and that I've been through just to make a difference and pave a way better for other patients. So it's a privilege. But this EIR report is truly groundbreaking. And why I want to point this out is because there's been a lot of studies that's talked about maybe survivorship and talked about different areas of a patient's journey, but AbbVie is leading the way of being the first to actually look at the emotional side, the psychological impact of a patient. And they're looking at different perspectives of Hispanics, Blacks, and Asians, and also comparing that with Caucasians as well. So I am so lucky to have all of you here today, but also for this incredible panel to share the stage with me so we can really break this down. So I want to begin by introducing our panel. First, here on the end, Reggie Ware from BlackDoctor.org, considered one of the nation's largest and most trusted health and wellness destinations of Black Americans. Next to him, Dr. Brian Koffman co-founded the CLL Society, a leading group dedicated to the unmet needs of the CLL community. Then we have Aisha Diallo from the Patient Empowerment Network, a public health practitioner who deeply understands the patient journey as part of her long-standing community work. And last but not least, we have Dr. Andy Souers, who is the head of oncology research at AbbVie. And Dr. Souers and his team leverage their combined expertise to find new ways to improve the lives of patients affected by CLL. And so to truly understand this patient journey we're going to unpack today, it's important to understand the disease. And so I want to tee off this conversation by letting Dr. Souers explain a little more about what CLL is.
Yes, okay. So there's a couple of points that we definitely gotta have to start off with. I'm gonna try to keep this to 3 minutes or so as for everybody's benefit. But basically, where I want to start is we actually started really digging into this disease a long time ago. So actually, I go back to the mid-90s. Chemotherapy dominated all CLL treatment. So this chronic lymphocytic leukemia, everywhere we would go and see basically patients and sites, it was all chemotherapy. So we all know that chemotherapy can be effective, but we really wanted to dive in and find a targeted agent, so something that would spare some of those healthy cells and kill the cancer cells. So we started this again back in the 90s. It took us a very long time to really understand this disease to the extent that we do now. So ultimately, just as a kind of a refresher, or maybe starter for some of you, so basically this is a disease that starts in the bone marrow. You have these white blood cells, these lymphocytes, which ultimately become malignant. It starts off as a very slow-growing disease, but it actually starts to multiply. During those sort of logarithmic phases of that cancer growth, it's really tremendous. So they will literally crowd out all of the healthy cells of the entire body, and it's really a spectacular challenge. Now, I wanted to throw out come back to the disease and throw out a couple of the facts here, and I think you can all see that CLL is about 15% of adult leukemias. About 20,000 new cases a year. Unfortunately, still over 4,000 deaths a year, and this, of course, is in the US. What's really striking is you look at these sort of demographics, mostly Caucasian. This is about 2 to 1, male to female. The average age is around 70. So you can imagine that the typical CLL patient that perhaps a doctor is going to see walking through the door. This stat below is really the most striking. So just barely over 10% of CLL cases are non-Caucasian. You think about, say, a community physician, maybe they'll see 3 to 4 CLL patients a year, depending on the region. There's a very good chance they're never going to see that full demographic of the disease, and that's really, really striking. The last thing just to mention is this watch and wait period, and this gets back to what you see on the title. This starts off as a very slow-growing cancer. Imagine somebody gets a diagnosis with what could be a deadly disease, but ultimately, we're effectively going to watch and wait for a while. And so this is where we see this really incredible range of emotions as these patients sort of digest this diagnosis, but then ultimately realize that they're not quite going to get a treatment option just yet. So really, really fascinating. And so ultimately what we're going to talk about today, of course, are the emotions that these patients experience, not only at this beginning part, but really throughout the entire journey. This is an extension of the work that we're really doing to try to understand and hopefully address this range of emotions, particularly in the different sort of diverse ethnic groups. So from that, let me stop there, but very, very glad and happy to be here today.
And it's so insightful what you said, because as I go to this next slide, when you talk, it's a watch and wait disease. From an emotional standpoint, there's nothing watching and waiting for us, and there's nothing slow about the emotional toll that begins to take over for a patient. It's immediate. And then what concerns me is, and I'm gonna try to stay on message so I don't get in trouble, but what concerns me is you said they don't see so many people of color, so they may not have that level of expertise of how to engage with them. So we asked the question, AbbVie asked the question, what if we could gain a deeper perspective on the emotional impact of a CLL diagnosis of ethnically diverse lives? And again, AbbVie is leading the charge because they do want to facilitate change and not just do an emotional impact report and talk about it, but take actionable steps with patient organizations of how we can bring change. So what they did was looking at a significant group, looking at Blacks, Hispanics, Asians, Caucasians, and seeing where is the problem. And when you look at the slide, you'll see that there is a great need for help. So what I'm going to do is I'm going to go through 2 slides first, and we're going to talk about culture on these first 2 slides, and then I'll open it up to the panel. But I just want to establish everyone here and talk about, just look at the bottom of the slides so you can just get established with the color coding. Black we have in blue, Hispanic is purple, Asian is green, and Caucasian is the teal blue. And it reveals really what we already know intuitively, that culture plays a huge role. And so if you look at the data points, on that first data point, nearly half of all Asians say that they want support resources that are personalized to their culture and to their beliefs. And then when you look at Caucasians, it's just a sliver. It's just 2% who are not only 2% concerned about this. And then you look at the next data point, and across the board, looking at all the ethnically diverse groups, nearly 40%, 4 in 10 people wanted to discuss their CLL with an HCP who shares their race and ethnicity. So we're really not talking about the same language, but understanding a lived experience, understanding my culture, Cuban culture, Afro-Latino culture, Black culture, Asian, and Hispanics as well. So looking at these numbers, it's not startling considering what I've went through, but I want to go through one more before I send it over to all of you, is the sources, where they are learning about CLL. And when you take a look, Hispanics are the lowest usage of patient support groups, yet nearly half of them have trouble talking to a family member. So just looking at that, where the Caucasian is so far out ahead, and you think about with Latinos alone, and I know we have issues with all groups, with the Asians and Blacks, but looking at Latinos, if nearly half can't talk to their family or don't feel comfortable, and they're not going to the support groups, where are they getting their help? Because we know that this is tied to adherence and it's tied to outcomes. And so we talk about, is this an access issue? Is this a trust issue? Or when we look at the support groups, is this an issue that maybe we need to reframe how we create support groups, that they really appeal to those of diverse backgrounds? So to begin our conversation, I want to begin with Reggie, and after Reggie, Aisha will send it to you.
Sure. Could we go back to the previous slide?
Sure.
Yeah. First of all, I want to give a lot of props to AbbVie for really looking at this situation the right way, and that is, humanizing the patient population, because, I think that's got to be the cornerstone of how we approach people when we're trying to get them to take significant actions. And this survey here is the absolute right step in the right direction. Now, when I look at this first slide and I look at the first question there, and they talk about people wanting resources that are personalized in their culture, you see the Asian and the Hispanic market, right, really, really big, and you see Blacks really big too. But what I look at is I compare it to the whites, because, a lot of times when you talk to marketers, they'll say, well, I understand, the Latino market, Asian market, I may have to do a language thing. And they assume that the Black patient, right, or consumer is the same as the white consumer. And they ignore the most important part, which is culture, right? Because the Black community is a subculture, and what I like here is that demonstrates that as Black people, we see ourselves different than our white counterparts. And for the person, the company, the organization that recognizes that, it gives you a leg up and an opportunity to have really important conversations. So I think that was really important. And the HCP point is spot on. And here's why. We are a consumer health website, but our name is blackdoctor.org. That's exactly why we named ourselves that, because we knew that there was a study done by Johns Hopkins. This is our 20th year. So this study was done 20 years ago. Dr. Thomas Levis at Johns Hopkins. And his study asked people, would you prefer to see a doctor of the same ethnicity? And everybody across all ethnicities say, absolutely, I'm more comfortable, right? And that's a really good point. That's why we call ourselves blackdoctor.org. The challenge is only 3% of the physician population is Black. So in a perfect world, if every Black person wanted to see a Black physician, they couldn't. So, so we make allowances for that. There's telemedicine, and there are other things that you can do. But for us, what we do is we emphasize culturally sensitive doctors, similar to what you were saying. They may not speak to a patient of a different ethnicity, but you've got to have that awareness. And having that awareness and understanding goes a long way in getting people to open up. So.
And Aisha, that's some great points that you made, but Aisha, I want to send it to you as well. Especially we pointed out the information about the patient support groups. If many patients, and you see the Latinos first, and then Asians, and then Blacks not utilizing or underutilizing support groups, is it that we need to reframe how we do support groups and maybe have more of a cultural spin where are we not speaking that to them in the right way?
I do like that question, and thank you so much for the opportunity to be here, and thank you to AbbVie for making this available and possible. I think this is a door opener to really talk about underlying issues that we haven't really spent a lot of time talking about or acknowledging. Us on our end, working for Patient Empowerment Network and being on the advocacy front, these are issues that we hear all the time that we cannot ignore. So knowing that besides the physical aspect of CLL as a disease, there are other things that patients are going through. The emotional aspect is something that we cannot ignore, where they obtain their information, how they see themselves, acknowledging the uniqueness of their background, their value, their culture, and really understanding that and being able to have in a healthcare professional team that they could sit with and really talk about issues that are important to them and be listened. And to go back to the question you asked, when we talk about where, especially for Latino, Latina, and Latinx patients, where they're getting their information and not necessarily going to support groups, I think the most important thing for us to remember is that people will look at information based on where they feel comfortable and based on where they are. So the first part is making sure that we are providing them that platform, right? To say, this is where I would like to obtain my information from. This is what I feel comfortable with. And this is who I would like to talk to open up that door. So maybe it's not just about looking at whether they're going to a support group or not, because we understand that depending on the culture, depending on the values, they may not feel comfortable talking to other people. Mm-hmm. And that's another thing too. They may not be comfortable with that yet. Maybe what they're comfortable with is to just know someone in the neighborhood that is sitting with them, listening to them, who looks like them, who's understanding what they're going through, having a healthcare team that looks like them, that understands their uniqueness, and that could say, okay, I do practice cultural humility. I will take the time to listen to you and your concerns, and I want to know what those concerns are and how we can better help you. I think it's first listening to the patient first and finding out what their needs are in order to really direct them to the resources that are appropriate for them.
And also helping them find the resources.
Absolutely.
I know I was a medical reporter and I'm sitting in the hospital going, where do I find the resources? So I felt like if I'm well educated, well connected, and I'm having trouble search to find the help that I need. What about the underserved communities? Which is so important to point out. With that being said, I do want to go on to our next slide, and we're going to look at one slide and then get everyone's insights on this. Challenges at diagnosis, the emotions and worries about the future. And if you just look, where Hispanics are outpacing everyone in every single category. 3/4 of Hispanics are uncertain about what to do next at a time of a diagnosis. 30% don't feel heard. I don't feel heard all the time when I go to the doctor. The minute they see PTSD and depression, they start to tell me my PTSD is talking. And then I have to say, I'm a global advocate. I'm not going to take that for an answer. This is what's going on. This is the scan I know I need. But not everyone can say, oh, I went to ASH, and here's what I need. And they don't have those resources. So looking at this is pretty concerning. And I say when someone says it's a language barrier, I'm like, no, this is a listening barrier. Right. We have a listening barrier problem. So I want to send to Dr. Koffman, I want to have you give us your insight first, and then we'll let the rest bring us your insight.
Well, first I want to thank AbbVie for the opportunity to be here, but also for the foresight to look at this issue. And I think what's really new about this, that's already been emphasized by my colleagues here, is that one size doesn't fit all, and we have to be sensitive to the individual in front of us and what their history is and what's important to them culturally, educationally, socially, all of these things, financially, all of that stuff. The situation with CLL is very unique because for the vast majority of patients, when they're given a diagnosis, they're saying, you have a cancer, it's incurable, and we're not going to do anything about it. So there's this cognitive dissonance immediately. There's two responses. One says, great, we're not going to do anything about it, that's the best news ever. But the majority says, are you really a doctor? You know, because that's not what happens when you get breast cancer or a colon polyp or anything else. So we have to explain to patients, you know, that there's no evidence that early intervention, and a significant percentage of patients, no evidence that early intervention makes any difference. A significant number of patients never need treatment, and we can't perfectly predict who that's going to be. So why treat you if you'll never need treatment? But these are sophisticated concepts, because as soon as the patient hears the word cancer, they don't hear anything else. You know, so you're talking and they're not hearing. And especially if there's cultural barriers already in place for this. So it's a very difficult time for patients. So patients often are diagnosed with CLL when they're asymptomatic. And they come in, they're going to have a hernia repair, they get a blood count, and their white count is up and they found they have CLL. The vast majority is just a routine blood count, and it's found that way. Suddenly you go from asymptomatic, I'm a healthy person, I jog every day, whatever, and now I've got an incurable cancer. You know, so it's such a difficult time for patients. And if we don't help the patients through that and understand that they go from being asymptomatic to quite symptomatic, emotionally symptomatic, and help them in a cultural way and build support mechanisms for them, we're really failing our job as healthcare providers.
Yeah, because it is an emotional fight. And I know when I was going through my own journey and I started to report from my bedside because I was an unemployed reporter, I'm like, I have nothing but time but to educate and empower people. But I would always share and say that if you can't help me mentally stay in the game, I can't stay in treatment and on treatment, because my mental well-being is tied to my adherence. And so it's so important that we continue to have this conversation, because when you're talking and explaining how a CLL journey works and plays out, it's scary for a patient. You don't hear anything after you have cancer. Dr. Souers, what is your take when you look at this slide?
Yeah, I mean, this is absolutely fascinating. There's sort of a range, I think, of emotions, for example, that many of us felt when we saw this. If we look at something like transportation, clearly that's an asymmetric problem. You know, the problem solvers in us think that we can go back and study this, study sort of regions, and maybe even come in with solutions. Probably going to be more complex than we think. But to be honest, looking at almost every other one of these, this was like a gut punch. I mean, this sort of sucked the wind certainly out of me when I first saw it. When you think about uncertainty on next steps, that is just an unacceptable range there. You know, I think a lot of us think about our own experience, let's say with family members at major medical hospitals where, for example, there's good insurance and things like that. There's enough uncertainty there. You look at something like this and clearly this is an opportunity. We have to do much better here.
Well, and we were sharing the numbers that 80 to 90% of cancer patients get their care at community cancer centers. So if we don't get the resources or help them understand at time of diagnosis what their next steps are, we will lose them in the process of not even staying on treatment or following up at the appropriate times. Reggie or Aisha, is there something you want to say before we move on to the next slide?
Okay, you know, this is a fascinating slide. The uncertainty piece is just, it blows me away as well. You know, I'm looking at it through the lens of the black patient here, and I see the lower number for coping with emotional reactions. And I think that is tied to this, you know, there's a number of studies that shows that blacks expect they don't think they're going to get a positive health outcome anyway. And so I think that it's lower because they're not expecting to have a positive health outcome. I thought that was interesting. And then the next point about, and I think this is critical, and you see this point show up in a couple of future slides in the future, but this, the caregiver, you know, worrying about the effect, how it's going to affect my relationships, right? And, you know, it keeps showing up, and I think that caregiver, that family support is really critical. And what I've heard from experts say is that they really need to, if they don't understand how the disease works, like you broke it down so eloquently, right? And if they don't understand what the disease is, then it sort of prohibits them from talking to other family members to get the support. And so we've got this is showing that there's some opportunities here. These problems I see as opportunities.
I thought that was very interesting too, looking at this, because this is what we hear all the time. But really looking at, when it comes to Black patients, when we talk about coping with their own emotions, it's not necessarily that yes, there's a stigma attached to a cancer diagnosis. It's about not feeling necessarily comfortable accepting it for themselves. And there's also the resilience that exists in the Latino and in the Black community, where you feel like you could tackle anything that comes your way and you could do it, yes, with a sense of community, but you could do it on your own first. And I think this is, when I look at this data, I'm thinking about, how do we peel this onion to really understand, when I talked about earlier, the uniqueness of all the different groups, and really understanding the why we usually take things the way that we do, why we feel that, for example, it would be putting everything as a burden on the care partner that we have. And why is it that when you look at feeling like a patient all the time, that they are really identifying that way? And I thought that was very interesting, because even when you look at describing your symptoms, we know that a lot of patients struggle with the description of symptoms versus side effects, not really knowing, how do I make the distinction? When I had a conversation with my healthcare team, they didn't really make that clear to me. So when I see this, I see how important it is for us to continue to really work hard for underrepresented communities, and to really be present for them and meet them exactly where they are.
Well, and it's often that we don't feel understood as patients and survivors. To this day, and it's often because I feel like a career patient even now, when I have my breakdowns and I'm crying, I'm saying nobody gets it. Nobody understands the emotional trauma of, you're one blood draw away from going back, being separated from your family, one blood draw away, some more bad news, and that level of anxiety. And it does deteriorate. It affects your relationships. My husband and I had to go through marriage counseling, because if you're Latino or Black, Asian, and you're the center of your family, and your family can start to fall apart. Once the finances fall apart, everything else, it's like a domino effect. And that brings me to this next slide, is talking about the challenges faced during treatment. And this slide hits really hard, because ethnically diverse patients are disproportionately worried. They're outnumbered. If you look at the Hispanics, where the Blacks and Asians fall versus where the Caucasians fall. And so if you look down the board, access to social support services, finding information in my native language, or transportation, Latinos are out ahead along with Blacks. The financial challenges, which then become that domino effect, worrying about having to be away from your family. Like, if you're Latina and you're the provider, then you're doing everything at home. Who's going to do that while you're away at treatment? So I would love for any of you to, everybody jump in on this, of what you make of these numbers. Dr. Koffman?
Well, I think the issues facing patients in terms of this the emotional needs here are underexpressed by patients. And I think it's conceptually very difficult, especially in CLL, because it's an extremely long journey. And it's not a disease, it's cured. So you're constantly, like you talk about this lab anxiety, scan anxiety, there's always a sense of this, what's going to happen. And the other thing that's happened is there's been a revolution in the care of CLL. So that there's a reason that people don't know what to do, because sometimes the doctors don't know what to do. And sometimes that's a good thing, because there's 2 or 3 excellent choices, and we'll deal with it when we get to it in 2 or 3 years from now. And as a scientist, you sort of get that. But explaining to a patient, I don't know what I'm going to do because I'm going to ASH, and there's going to be a new paper that's going to change what I'm going to, but the patients will get, so it's not something simple. When you have a strep throat, you get penicillin. Nobody says, should I really get penicillin? Well, if you're allergic, you should, but there's no question. But in CLL, there's so many different paths.
Well, and what concerns me as you say that is a lot of these doctors, and it's not their fault, at community cancer centers, they're not coming to ASH, they don't have time.
Right.
So this field is evolving so quickly, and they can't stay on top of it. And if they're only seeing a small percentage of the communities of color, they may not be getting the right diagnosis or the treatment that they would get where we know outcomes are higher at an NCI designated comprehensive cancer center, which I know that opens up a whole other can of worms and a whole other panel that we
let me share one thing that Reggie and I were talking about. This is studies that the Souers data, which looks at population base, shows that African Americans do not do as well with CLL as Caucasian patients. Clearly they don't do as well, they don't live as long. But a study by Dr. Adam Katai, who's on our medical ad board, showed that those same African American patients, when they went to a CLL doctor, had the exact same outcomes. So the problem isn't their biology, their problem is their access, their barriers. So you're absolutely right, because if you get good care, it doesn't matter what your ethnicity is.
Absolutely.
Yeah.
Honestly, looking at the second item, finding information in my native language, when I see that, it really hits home, because I think there are a lot of barriers when it comes to languages. It's not just the language that you speak, which is a huge barrier. And finding someone that speaks that language and understands what you're going through and could translate this complex information into that language. But it's also the conversation between the healthcare professional through the patient, speaking their language in terms that they can comprehend, and giving them the space and time to really speak up about all the other concerns that come up. Because when we talk about CLL, obviously we're talking about not just the physical aspect of the disease. We're here today to really talk about that other side, the emotional aspect that goes unnoticed quite often, but there are other underlying social determinants of health that are preventing patients from really accessing the care that they need. And we talked about this earlier, that most patients are getting their care in their community. Mm-hmm. So not having a CLL expert, someone that really understands the disease and that could sit with them and walk them through and really acknowledge all the other issues. We've heard so many times patients not being able to come to the doctor and seeing their physician and their other healthcare teams regularly, and come to find out later on, as you peel the onion, as you talk more to them, and you find out, you realize they don't have transportation. There's no care partner to either take them or watch the kids, and there's really nothing else for them to do besides probably sitting at home and missing that appointment.
Or their care partners trying to hold down a job. My husband couldn't take me because he had missed so much work. He eventually lost his job, which is another story, but I didn't want to bug him every time because I thought he cannot miss one more day of work because my life depends on this health insurance. So you ask for rides, you go on social media and ask for rides, and if you can't get it, then you don't go.
Exactly, which opens up the door to a lot of other financial barriers that often patients don't even feel comfortable walking to their healthcare team and say, hey, I didn't come because I just couldn't afford to come and I wasn't sure if my insurance was going to cover that treatment you just told me about, right? And it's also the assumptions too on the healthcare professional side sometimes to not bring up certain things that could provide hope or the opportunity to even look at other treatments or something else that could even be a possibility for them, and the lack of resources sometimes that are present. That here at Patient Empowerment Network, we work really hard to to make sure that patients and their families have credible, trusted information that are digestible and that they could really access, as well as healthcare professionals.
And that's
They can meet
important
each
to know
other.
that it's
Yeah.
digestible and
On the same
amounts
side.
that they can understand, and also to share with their entire family. I know, like with Latinos, when you speak to my husband, then we had to explain it. You have to explain it to the whole family. Like, we operate as a pack.
Yeah.
So everyone has to agree on what's going on. And so the resources need to be not just patient-facing, but caregiver-facing, so they understand, because everybody, just like in the Black community, we all have to sign off.
That's right.
And everyone has to agree or it's not happening.
Yeah.
Can I just make
Yes.
one comment? Because, so I am the least qualified to make this comment, so it's actually more of a question to everybody here, including the panelists and everybody, obviously, in the room. So again, looking at, let's say, the access to social support services. So what comes to my mind, being in the Chicago area, is all the hospitals that we work with and different clinics. And this goes, of course, from the northern burbs to the western burbs, all the way down to the south side of Chicago. So there's a very large socioeconomic range there. This is heartbreaking, of course, when you see it the first time, because that's a huge gap. Access to social support services. Everything that we've sort of come to understand is that this is one of the most critical ways to get somebody through this journey, get a patient through this journey. Here's the naive part. When we look at this, I would say where it looks like there may be reason for some optimism is we scan kind of routinely through different kind of social media. Typically, I try to keep my girls off social media, but in this case, it looks like there's sort of, I wouldn't call it a proliferation, but certainly an upsurge in even small groups of sort of patient advocates. We find that incredibly exciting. We don't know how to track it, of course, and understand the true impact. But I would love to hear if there's any comments on how this sort of almost organic growth of these advocacy groups is impacting patients, or is it?
Yeah, well, I'll go first. You know, I think there's a huge opportunity with the support groups, because support groups, they do, but it has to be the right support group. And so the way I look at BDO's role in terms of healthcare for blacks is we're that trusted intermediary, right? And so you have these support groups, but you sort of need a person to co-sign for some of these support groups. And the support groups themselves need to have the right diversity, right, or ethnic composition, so that when people tell their story, people can see that this is something that, okay, this applies to me and so forth, right? But I think that when I look at this, that's what jumps out. Well, the language thing jumped out at me too, because you see blacks are saying, hey, I'm not hearing things in my language. But I think that the support group, there's power in people sharing their story. And those stories can be inspiring, and it helps people, it helps to overcome concerns without, it goes from me telling you what to do to us together figuring it out. So I think there's power there. And again, I see the caregiver, when I look at the black patients, that caregiver piece is critical, like you were saying.
Relatable.
That's right.
I'm going to go on to the last slide so we make sure we have time, and then we can circle back on this because that is a great question. The last one is treatment status, life outlook. And if anyone says a picture speaks 1,000 words, I mean, look how grateful and content a patient is when they are off treatment. I mean, when you can feel, I mean, there's nothing normal about your life after cancer, but I can tell you to feel some sense of normalcy. For me, my treatment, I was in the hospital for a year from January through Christmas, and the level of depression that just compounded while I was separated from my 2-year-old son. So to tell a patient that you can be off treatment, be on treatment and then off treatment is a game changer. Who wants to, I'm sure you have a lot to say about this.
I do, and again, I'll try to keep it brief. Okay, so like you said, this speaks 1,000 words, and it does bring me back to one of our ultimate goals, which was absolutely driven and inspired by speaking to patient groups, which was the idea of the finite duration therapy. And so if we go back to, well over 10 years now, our vision, and it wasn't unique to us, but we certainly put a lot of effort and passion to this, was to try to design new types of, say, drug regimen that would allow us to dose for a certain period of time and then stop, by design. So we've run a number of clinical trials, and of course, I'll leave that for another discussion. But that remains a key goal. And I think every time we think we're getting somewhere, we get fantastic feedback by doing market research, going out and speaking, and it's always more complicated than we think. So we're very excited about this on one hand because we want to get to that purple bar as much as we possibly can.
And we want you to.
Yeah, so we just know when we're sitting there tinkering away in the lab, it's not quite that straightforward. So again, love to hear what the rest of the panel.
Dr. Koffman, what is your take when you see this?
Well, patients don't want to be reminded of their cancer every day, and no matter how good the drug is, it has adverse events, it increases the risk of resistance. There's all kinds of reasons you want to limit the duration of therapy. And there's all kinds of scientific and medical reasons, but there's a lot of psychological reasons too. So to be able to give patients a tremendous level of efficacy with the therapy, and to be able to stop and get back to normal, even knowing that you're probably going to need another therapy. I mean, the reality is in CLL is none of these therapies are curative. So you're going to kick the can down the road. But if you can do a 1 year of therapy and get 5 years of glide, and then do another year of therapy, or maybe 2 years, and then get another 3 or 4 years, I mean, suddenly you're a long time. And I do want to just go back for 1 second to the patient support groups. We have at the CLL Society, we have 42 plus support groups across the country for patients. And when patients meet a patient, especially a patient of their same ethnicity, their same color, and they've been through that treatment, and they've had CLL now for 15 years, and they look healthy, that's more powerful than anything any hematologist can ever say to them. Yeah. And that's what we try to build. It's not Pollyanna. I mean, there's people get bad outcomes, people have side effects, but that kind of support one patient can give to another, you just can't buy anywhere else.
Feeling understood. Well, we don't have so much time left, but I do want to just have each of you give 1 minute about your key takeaway from the emotional impact report and the fact that AbbVie is doing that and really, leading the way in looking at the emotional side of a CLL journey.
Yeah, my key takeaway is I'm very appreciative of AbbVie. And they didn't ask me to say this, but I'm very appreciative of AbbVie showing leadership. Because the way the climate is now, there's less, there's people running away from looking at people, underserved population groups, and really giving them the care that they need. And you can tell the true measure of a man when things hit the fan, right? Mm-hmm. Everybody's running away, but if you notice, AbbVie's right there.
Yes.
You're doing the research, and it's inspiring, right? And so for me, as a CEO and publisher of a website, man, I'm happy and inspired to talk about things like this because I know I've got a real partner. So that's my key takeaway. You're doing the right thing, and you're doing the right thing. We want to continue to work together because we do work with AbbVie. We want to continue to work together because it's important work.
Dr. Koffman?
Well, again, echoing you, I'm very grateful that AbbVie is taking this head on. And I think what's really innovative about this is that they are looking at diverse groups. This emotional stuff has been studied, but not in this way, not with this granularity, not with this specificity. And I think some of this is really eye-popping and very disturbing. But there's actionable things that we can do. I mean, it's not that difficult to put things in different languages nowadays. Why aren't we doing this? It's not that difficult for us as an organization to build our patient advisory board to reflect the community that we're treating. You just have to be intentional about these things. And when I see stuff like this, it really wants me to put my foot on the accelerator to do that and to bring in these other people so I can get insights. So I'm very grateful to AbbVie giving me a push in this direction.
Well, yeah, I always say you can't just take a brochure and swap out a brown person. Like AbbVie is investing in this, and the fact that they're leading the way, looking at going another level to look at the emotional impact. Aisha, what's your takeaway?
Honestly, I was in awe when I saw this report because I felt that it was probably one of the first times that we weren't just as someone who's a public health professional that has dedicated most of her career looking at other aspects besides the physical aspect of diseases. AbbVie was really taking this on as well in looking at this and opening that door to be able to provide those resources that we are sitting on, that we have, that are not reaching the patients that need them the most in their family. So I love that this is the beginning to many, many more conversations, and that we are here to really start tackling that and moving forward to continue really take a deep dive into it. So I'm grateful.
Thank you. It is the beginning because AbbVie wants to facilitate change, and I'm sure that will be part of your final takeaway, that this is not just one study and then you're going to say, well, here's the facts. You're going to actually create some actionable change working with advocacy organizations. But I still would love to hear your input.
Yes, boy, I'm not sure exactly where to start, but maybe I'll do this. So it's the folks whose passion project, whose lives revolve around this data are not on stage. And so I just have to, it's sort of an awe of my colleagues that, we get to play a small part in this. But I would say, I definitely want to say that if you look at even I'm on the research side, of course. I have, a group of scientists and other staff. And despite, many of these folks working hour after hour in the lab, and it really is a passion project for, this is one of the more passionate fields you'll find. All sorts of interesting behavior, like 6 a.m. to 12 p.m. You have to push people out of the lab sometime. But at the end of the day, I think what sort of is sort of most inspiring when you're walking around the lab is when the scientists, the clinicians actually see the patient at the end of the road. And what this all starts with for us is again, just basically not only meeting patients, but really interacting with advocacy. That has just really changed the game for us. And if I think about where we were 15 years ago to where we are now, it feels like an epiphany. It's really phenomenal. So we just continue to be so inspired by all of the work that you are doing and everybody in the room coming. So incredibly grateful. And as you said, Aisha, you said it best, this is the tip of the iceberg. We can't wait to really dive into this. There are some heartbreaking statistics in here.
Yeah.
But as you said too, there's an opportunity. So.
It is heartbreaking, but it's so hopeful to me because we are, as you said at the beginning, humanizing this, humanizing the journey. I'm okay now saying I have PTSD and depression, severe depression, and I need help. How can we help everybody else? So I love that AbbVie's doing this and just leading the way and making this a game changer. And I'm grateful for the work that you're doing and everybody at AbbVie. We do have just a few minutes for questions. So I want to go to the first question that came in from the registration from the Patient Empowerment Network. What strategies do you recommend for managing the emotional challenges of a CLL diagnosis?
I love this question. Looks like did I write this question?
Yeah. Did you?
No, I didn't. I think one of the first places to start is to really take a deep dive into the trusted information that are out there. At Patient Empowerment Network, we have several resources. We spend so much time putting together programs that start patients from the time that they're diagnosed all the way through end of life and looking at their concerns, their questions, and really listening to them, and doing the same thing with healthcare professionals, understanding where they are too and educating them on becoming better listeners, spending more time with their patients and really understanding where they come from. And I think one of the first things that I always want to stress out is looking at not only the resources that are out there, but the partnerships. All of us here, sitting here on this panel, we all have something to bring to the table. So partnering with other folks to really make sure that we emphasize that voice. I know we talk a lot about support groups, but we have to understand that not everyone, they're amazing, but not everyone feels or is able to go to a support group. They may not have it available in their area, or they may not even feel well enough or comfortable talking to somebody else or other people around the table. However, having someone else as a peer-to-peer that they could talk to, that they could call, or that at Patient Empowerment Network, we have wonderful volunteers that we call our empowerment leads. And we have them in the different disease areas that we cover where they are looking, they're patients, they're survivors, and care partners. They're able to do a one-on-one interaction with another patient that's going through something similar to really give them that touch. And patients do learn very differently, so give them all the resources in a very digestible way and trusted way. I can't stress that enough. But really allowing them to see where they are and to obtain the information from there.
Great insight. Dr. Koffman, I know we have just 1 minute left, but what actionable steps or what do you see with your organization that can be done given this EIR?
Well, I think you made a lot of good points, and we try to reach out to patients in different ways. So we have these support groups. Most of them are virtual. So, and when they started with COVID and stuff, making them virtual, we had to provide laptops and stuff to patients, because some people, and this is an elderly population, and train them how to use Zoom and things like that. So you have to kind of meet patients where they're at. But we also do peer-to-peer. We have chaplaincy service. We have ambassador programs for people who've been through things. So there's all these different options, but also there's things that we don't do that other organizations do that we have to work with. But I think it starts with the patient having to feel, I'm not alone. Other people have the same issues as me. This is not unusual. And let it go. It's share with your healthcare team, share with your family, share with your friends. You are not alone in this disease. Cancer is a team sport, and we're part of your team.
Yes, absolutely. It is a team sport, and you have to lean on others. You all have been amazing. Reggie, Dr. Koffman, Aisha, Dr. Souers, thank you so much. And I want to remind everyone that AbbVie is going to continue to facilitate change and take the EIR and make an impact and really pave the way for a better journey for patients. If you want more information on the press kit, it will be on AbbVie's website, and I'm thrilled that all of you can join us for this important conversation so we can just make the path better for patients going forward. Thank you all.
Yeah.